Now we will see the delusion disorder. Delusion disorder is a disorder in which the patient has a false perception of something or false belief that usually it's not a hallucination, it is just a delusion, not hallucination, and the patient doesn't have the characteristics, for example, of schizophrenia, of hallucination, negative symptoms, disorganized speak, don't. The patient only has, well, could be more than one, but is a delusion that is not affecting the patient's life. So the delusion that doesn't affect the patient's life could be, for example, a woman that thinks that she's going to save the world, and so she thinks that she needs to act very very nice, and if she does this, the world would be saved. And the patient does everything normal, can go to work, can socialize, etc., and there is no interference of this delusion with the patient's belief. So that's delusion disorder, in the sense that the patient is having some false belief, but is not interfering with the patient's life. Now, this should be present for more than a month, and certainly should not affect the life of the patient. When this is shared with a familiar person, could be the child or could be the partner, then this is called folly adeux. That means that usually they are believing the same kind of false belief, usually because the parent makes the child to believe that. So in any case, if it is the parent or the partner, the treatment is to separate them and to try each one separately. And the treatment is just psychotherapy. Now, there are various types of delusion disorders. These include aromatic, yellows, grandiose, somatic, mixed, and unspecified. For example, of the yellow one could be a man that thinks that the woman is with another person, and so the delusion is that thinks a lot of things in relation to that delusion, that the woman is engaging the or is lying to the partner, and that the woman is going with another person, etc. So this patient has a delusion about that. But in this case, it's very different, because the woman is very capable of that. So this man maybe is not having a delusion. Maybe it's in the right thing, because what the hell is doing that woman going with another person? Anyway, that's a kind of delusion disorder that I don't think that usually this should enter, depending on how is the relation, but it's a very complicated issue. There is other that is persecutory. The persecutory type is when, for example, the patient thinks that the Russians are going to conquer the patient, but just think that, and can talk to somebody about that, but it's like not interfering with the patient's life, is not making that the patient stay at home, etc., because then that could be maybe paranoia and schizophrenia, but don't. The characteristic thing is that delusion disorder doesn't affect the patient's life, does not interfere with the patient's life.